So the idea of the session difficult scenarios in the myeloproliferative spectrum was to pick difficult areas that people come across in day-to-day practice but not often, and also areas where there are gaps in our knowledge but new information. So the first presentation was given by Adam Mead, looking at new data for blast phase MPN, which is something that happens to some of our patients, and when it happens it's very difficult to manage. So covering new data with regard to the importance of p53 clones and their characterization, and also intriguingly the potential role of inflammation in driving clonal dominance. So very scientific but based on a very difficult clinical scenario, and then moving to the spectrum aspect, which is the overlap between MPN and MDS, and then Dan Wiseman, a local haematologist from here in Manchester, giving a fantastic presentation on science and clinical data in CMML, which is a very difficult and rare to treat disorder that has both proliferative and dysplastic features, and launching a UK trial called the AMO trial, which will involve a novel agent for these patients. So he also very nicely brought out different clinical scenarios that these patients have. So pruritus, splenomegaly, very proliferative, very MPN-like, but also autoimmune diseases and cutaneous involvement. So trying to be practically useful but also looking to the future. And then finally, we were really pleased to have Jacques to talk about some work we've been doing actually in the European collaborative space, led by Jean-Christophe Iannotto, Jean-Jacques and myself, looking at patients diagnosed with MPN before the age of 25 and trying to look at what was the outcome, what is the complication risk for those patients, and to try to help us to think about how we should manage these patients going forward. So that was really helpful. Surprisingly, a lot of data with regard to the high prevalence of splanchnic vein thrombosis, some outputs with regard to pregnancy, but also highlighting the fact that our current prognostic scores don't work very well in that disease group. So again, hopeful that that was practically helpful, but also highlighting a way that we can work together and generate real-world data to then try to move the field forward.